I'm going to back off my video now because it gives me a stronger bandwidth.
Oh, yeah. Can everybody see my slides? Barb, are my slides up?
Yeah.
Okay, thank you. Good morning, everyone. My name is Mary Ennis, and I'm the Outreach Coordinator for Seniors NL. I want to welcome you all to this week's Let's Talk, and today we'll be talking about a topic of importance to everyone. I'm sure it's important to everyone because I don't think there are very many of us out there who aren't taking some kind of medication these days. And we're going to be talking about safer meds. Our weekly Let's Talk and Just to Ask sessions are supported by United Way, Newfoundland and Labrador, to whom we are very grateful, of course. Before I introduce today's presenter, I'd like to cover a few brief housekeeping tips with you. Some of you are used to these by now, I'm sure. I ask everyone to mute your mic to block out outside noises. If anyone needs captioning, there should be a closed captioning CC button at the bottom of your screen. Any questions or comments you have during the presentation, you can enter them in the chat box. Just click on chat at the bottom of the screen, and the little box for you to type in will come up on the bottom right corner. And as I mentioned earlier, this session is being recorded to YouTube, and tomorrow, hopefully, if not today, I'll be sending out a link to the session so that if you need to refer back to it at any point in time, you can do so. And presentation requests, that's the last one we have. We do all these presentations that we do were suggested by seniors or service providers or someone. You know, we don't just pick them out of a hat as we go along. We do welcome any suggestions that anybody has for a presentation on a topic that you might be interested in. And I'd like to just take a moment now to acknowledge the land that we live on. We respectfully acknowledge the land on which we gather as the ancestral homes of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Uktahumguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homelands of the Innu of Nitassinan, the Inuit of Nunatsiavut, and the Inuit of Nunatukavut. We recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all. Have you ever wondered if a medication you're taking is working for you? And have you ever questioned whether or not you still need to be taking a certain medication? Have you ever asked yourself if that ache or pain you have is a side effect of one of your medications? All familiar questions, I'm sure. Today's speaker, I will point out, won't be able to answer any personal questions that you may have. You know, if you have a personal question about your own medication, she won't be able to answer that because she doesn't know your individual circumstances or have access to your personal medication profile or medical history. So any questions like that, you can refer them to your primary healthcare provider. Personally, I usually suggest to people that when you get your prescriptions filled at the same pharmacy, if at all possible, and always ask your pharmacist who knows your medication history about any new medication that you might be thinking about trying, even over-the-counter drugs. Because, I mean, face it, pharmacists, they're trained, they're specially trained in medications and drugs, okay? So they're my main source of information all the time. And I usually find that a lot of times, especially if my doctor wants to try something new, that they will refer to, the big Bible of medications, or they will, suggest that you talk to your pharmacist anyway. Okay, so our speaker today will discuss the importance of being informed about your medication, how to ensure that your medications are still benefiting you, and the work that SaferMedsNL initiative is doing across Newfoundland and Labrador. And I'm pleased to present today's special guest. Kelda Newport is a pharmacist. She's currently working as the project coordinator for SaferMedsNL, and that's the provincial Prescribing and Medication Appropriateness Initiative. Kelda graduated from Memorial University in 2010 with her Bachelor of Science in Pharmacy and her Bachelor of Science in Biochemistry, Nutrition. Kelda is currently working towards her Master's in Public Health at Memorial University of Newfoundland. She's going to be one of the most educated people I know, I think. Kelda's passion and true appreciation for medication appropriateness has fostered throughout her career working with patients struggling with mental health and addictions, and in particular, opioid dependency, where she gained valuable knowledge for different harm reduction strategies, including the deprescribing of unnecessary, inappropriate, or potentially harmful medications. And now, without further ado, because I have certainly said enough, we'll hear from Kelda about improving the use of medication across Newfoundland and Labrador. And once again, as we move on, any questions or comments, you can enter them in the chat box. At the end of Kelda's presentation, we will look at any questions in the chat box that you have, and she will respond to them. And time permitting, we will also open the mics so that you can ask any other questions that you have. So I'm going to take my slides down now, and Kelda will put hers up and start. Thanks, Kelda.
Wonderful, thank you.
Share screen at the bottom.
Yeah. Oh my goodness, here we go. Alrighty, everyone, can you guys see that okay now?
That's wonderful.
Okay, perfect. Thank you so much, Mary, for that introduction, and good morning, everybody. I'm absolutely delighted to be here this morning. So thank you for the invitation and a platform to be able to discuss the inappropriate, or how we can improve the appropriate use of medications across Newfoundland and Labrador. I'm going to jump right on in. So this morning, I'm going to have a look at the medication use in older adults across Canada, as well as in Newfoundland and Labrador. We're going to touch on the concept of deprescribing and how that influences or relates to the appropriate use of medication. We're going to check in on what's happening in Newfoundland and Labrador to improve medication use. And then finally, we're going to look at what you can do to become more informed about your medications. So when I start any of these presentations or talks, I really like to ensure that I set the stage for, I guess, the conversation that we're going to be having. And I think it's really, really important to say that medications are certainly one of the miracles of the last 100 years or so. And they are certainly something that's definitely necessary for health. So we take medications to improve our health. We take them for symptoms, like if we have a headache, we might take some Advil or ibuprofen or acetaminophen. We certainly use them to manage chronic conditions such as high blood pressure, diabetes, as well as taking them to prolong life expectancy. So there's no doubt that certainly there are many, many, many benefits to taking medications. With that said, things change over time, and certainly something that was once good for somebody in the past may no longer be good. It can change over time. And so I guess really what we're trying to promote with our initiative, and as a pharmacist I try to promote, is that we really want people to ensure that their medications are being reviewed regularly. It's an individual decision and an individual assessment needs to be done between yourself and your healthcare provider. So that could be your family physician, it could be a nurse practitioner, and it could in your community, or it could be, a pharmacist in your community. So whoever you have that relationship that you feel like you can have that conversation with, I really recommend that you do that regularly. So just to kind of set the stage for medication use across Canada and then in Newfoundland and Labrador, I'll give you a second just to think about how many Canadians over the age of 65 do you think take 5 or more prescription medications, and then give some thought to 10 or more prescription medications. Of course, if I was in a room, people might jump in with some guesses, but I'm not there, unfortunately. So 66% of Canadians over the age of 65 take 5 or more prescription medications. So this doesn't include vitamins, herbals, or over-the-counter medication. And 25% take greater than 10 medications. And I don't know if you'd be surprised by this or not, but about 38% of people over the age of 85 take 10 or more medications. So I found that number quite astounding when I first learned it. So now give some thought to whether or not you think Newfoundland and Labrador is higher or lower than those numbers. How do we compare to the rest of Canada in terms of our prescription medication use? So 80% of seniors in Newfoundland and Labrador take 5 or more prescription medications. Oops, is that not jumping in? There we go. Sorry about that. The Zoom screen was in the way, I think. And 40% of seniors in Newfoundland and Labrador take 10 or more prescription medications. So if you look back, we have 66% across Canada compared to 80% in Newfoundland and Labrador who take 5 or more, and then 25% of seniors in Canada take 10 or more versus the 40%. So, we do obviously take more prescription medications, and there's a whole lot of different reasons for that. However, we're going to discuss some of the things that we can do to ensure that the medications that we are taking are in fact necessary and benefiting us. So here in Newfoundland and Labrador, I'm sure most of us are familiar with the health accord that was recently done, and they presented an interim report. And in that, they did an assessment of the potentially inappropriate medications that are prescribed to seniors here in the province. So there was almost 120,000 seniors in Newfoundland in 2020. And of those who were potentially prescribed inappropriate medications, we had 65% of seniors versus 44.3% of seniors in Canada. So we obviously, have some work to do in terms of what we can do to improve the use of medications, because as I mentioned at the beginning of the presentation, it's absolutely necessary to take certain medications, but at a point in time when those medications are causing us more harm, they're no longer benefiting us, they're unnecessary, they're costing us money, they're a burden to us, then we really need to assess whether or not we need them. And that's kind of what's being coined into this potentially inappropriate medication, that this number is those types of medications. So we're going to have some discussion on those and what we can do. So why are seniors, older adults, particularly sensitive to the effects of medications? Well, as we get older, the brain does become more sensitive to the effects of medications. They stay in our bodies longer because we have less muscle and more body fat. Our livers and kidneys don't process medications as efficiently as when we were once younger. And then our bodies contain less water, and therefore medications can become more concentrated. So there's a whole realm of reasons why we become more sensitive to medications as we get older, and just reinforces the need to have an assessment of our medications and to be ensure that the ones we are taking are benefiting us. So, there's a couple of things that are involved in what would be considered potentially inappropriate medication. And one of those would have to do with the number of medications we're taking, because as the number of medications we take increases, so does the risk of those medications. But it's not only the number, it also has to do with whether or not those medications are risky. So that's the conversation I'm going to have over the next few minutes. So polypharmacy is a term that's used to basically describe taking a combination of medications that are doing more harm than good. So sometimes if you hear about this number, they talk about 5 or more medications, that type of thing is what we coin polypharmacy. But really, I don't think the number is what's important necessarily, because it's really, if you're taking 5 medications and you need those 5 medications, well, that they're not doing more harm than good. So it's really about medications that are causing more harm than good, and not necessarily if it's 5 or 4 or 6. If you're taking one medication that is not benefiting you, then you shouldn't be taking it. So basically, polypharmacy increases the risk of the harmful effects of medications, such as drug interactions, falls and fractures, memory problems, and hospitalizations. Taking more medications increases your risk of falls. Therefore, if you're taking 4 to 7 medication, this doubles your risk of falls. And if you're taking 8 or more medications, your risk increases even more. Furthermore, medications have unpredictable effects when they interact with each other, and these interactions can lead to harmful effects of certain medications, or in fact, they might cancel out the effect of a medication. And the more medications we take, the higher there is a chance of interactions. As an example, when we take 8 to 10 medications, the risk of an interaction increases by 8 times. And again, you know, there are what is going to drug interaction is a lot of different things. It could be that it increases the concentration of a medication and therefore you need to adjust the dose. Or it could be that it's causing you a side effect that can be, you still need the medication, but it's causing you a side effect that needs to be managed. Or it could be that there's a better medication for you that is, you know, a safer alternative, but is equally as effective. So there's a lot of things that need to be considered when we're looking at our medications. So as I said, number is one thing. So as the number of medications increase, so does the risk. But there are also medications that are just risky medications, especially for older adults. So what are risky medications? These are when the potential risk of a medication outweighs the potential benefits, and a safer alternative exists for the same condition that is equally or more effective. So when we know that we have it, when we're taking a risky medication, we need to consider what can be done. And that brings us into the concept of deprescribing. So essentially deprescribing means reducing or stopping the dose of medication that may not be beneficial or may be causing harm. But it's much, much more than just reducing or stopping the dose or switching to another medication. It really is a shared decision-making process that's happening between a patient and their healthcare provider about a medication. And it's a conversation that needs to be had to determine, you know, first of all, is the medication causing more harm than good, or do you need to continue it? Second of all, if a decision is made, a mutual decision between the two people is made that, you know what, I think we're going to try to stop a medication. Well, then how are we going to do this? So are we going to just gradually reduce it? Is it something that needs to be gradually reduced, or is it something that can be stopped without, you know, immediately without causing any harm? Or perhaps are we just going to slowly switch to something else? Are we going to start to, you know, do some lifestyle changes to mitigate some issues that you might be having? So there's a lot of things that need to be considered in the process. And then once the process is initiated, so once a decision is made that, you know, this is the route we're going to go, then there's continuous, you know, aid throughout that process. So you're not just left on your own to stop a medication. There's follow-up. There's somebody that checks in with you to see how you're doing. Maybe the dose, you know, maybe a decision was made to reduce the dose, but it's happening too quickly and you're starting to feel the effects. Well, then, you know what, we can have that conversation with you and decide how can we, you know, slow down the taper of a medication. So it's a lot more than just deciding that we're going to stop a medication. It's a very, like I said, a shared decision that happens between a healthcare provider and their patient. A mutual decision is made about the best approach to take, something that the patient is comfortable with. And then there's follow-up throughout the process to ensure that everything is going smoothly. So why do we want to deprescribe? Taking medications may be necessary for health, improving symptoms, or prolonging life expectancy, like I said at the beginning. However, as we get older, the benefits and risks of medication may change. The risk of harmful effects and hospitalization increases when we take multiple prescription medication. With age, some medications become unnecessary or even harmful because of short-term or long-term effects and drug interactions. Furthermore, older adults are more susceptible to adverse effects of medications and are more likely to be prescribed risky medications. And you may or may not be surprised by this, but 71% of Canadian seniors are willing to stop a medication if their doctor said it was possible. So I thought that was a really interesting number, to say that people are thinking about this. This is something that is on their mind. They're may be concerned, or at least they want to be informed about it. And if they have the assistance and the help of a healthcare provider, then they're really interested in having this discussion. So going to switch gears a little bit now. That was kind of an overview of the how we're trying to improve, or why we're trying to improve the use of medications across the province and in Canada. This is momentum that's happening not just here in Newfoundland and Labrador, but there's work happening across Canada, but also across multiple groups in our province. And I'll speak to some of that in a little bit. Here in our province, we have some of the highest use of two particular medications. And so that's why I'm going to focus on sleeping pills is one. And next up, after sleeping pills, I'll discuss proton pump inhibitors, which is a stomach medication used for reflux. And the reason why we targeted these two medications is, well, first of all, we had to start somewhere. It's a big undertaking and we needed to start somewhere. But most importantly, the reasons why we wanted to look at sleeping pills is because they are really considered a risky medication for older adults. They don't have a lot of benefit, and I'll speak to some of that in a minute, and they do cause a lot of harm. Like there's sound evidence for the harm of sleeping pills and lack of efficacy of sleeping pills. So when we're talking about sleeping medications, what are we talking about? On the slide there, you'll see a list. This is the front cover of one of our brochures that we give out as patient brochures, but it's intended to be used with a patient and their healthcare provider. And it lists some of the common medications that are used for sleep. Some of these medications, I want to be clear, are used for other indications. They might be used for anxiety. They might be being used for depression. There's a realm of reasons. So when I'm in this presentation, I'm referring to the use of these medications for sleep. So I want to be really specific about that. And if you're unsure, if you're taking one of these medications and you don't know why you're taking it, well, that's one of the reasons why we're having this presentation, because we want you to ask your healthcare provider about it. That's simply what we hope you do. So many of you are likely familiar with some of these medications. So what are the harms of sleeping pills? Well, as I mentioned, they cause drug interactions, they increase our risk of falls and fractures, they cause memory problems, and they increase our risk of hospitalizations. So one of the biggest problems of medication overuse in seniors is the increased risk of falls. So 9% of all emergency department visits were as a result of falls for seniors across Canada. 50% of certain inappropriate medications, such as benzodiazepines, antipsychotics, and long-acting sulfonylureas, increase the risk of falls by 50% because they cause interactions like balance problems and dizziness. And with those issues, then becomes the risk of falls. And not only likely people are, given the numbers that we saw earlier, where we have, I think it was 40% of the population that's taking more than a 10 medication. Well, then we know that we're likely going to be taking more than one of medication that increases our risk of falls. 30% of seniors living in the community are institutionalized within a year following a hip fracture in Canada. And, this is a really staggering and sad number. 20 to 30% of patients who have had a hip fracture die within a year of that fracture, So when I spoke at the beginning of why we're looking at sleeping pills and risky medications, this is the reason. We want to prevent these numbers. We want to lower these numbers. And when we're talking about a medication that is causing more harm than good, then we see a really big reason why we should be focused on that medication class. So are they really worth it, sleeping pills? Let's see. Okay, So for benefits from sleeping pills, we have 1 person out of 13 will experience one of the benefits below. So 1 in 13 may get an extra 35 minutes sleep, and 1 in 13 who take a sleeping pill may get to sleep 14 minutes faster. Compare that to the harms. 1 person out of every 6 who take a sleeping pill will be harmed. So these include delayed reaction time and impaired cognition. What are these harms? Well, these harms, 1 in 6 will experience a 50% increase in falls, a 2-time increased risk of hip fractures, and it equivalates to a blood alcohol level of 0.06 to 0.11%. So those are really staggering percentages for the harms, and really very little benefit in terms of the benefit of a sleeping pill. And furthermore, the benefits often wear off very quickly with a sleeping pill. The body becomes accustomed to the medication, and then we need to take more of it to get a similar effect, and then we increase our risk even more because we're increasing the dose of a medication. Down at the bottom there is all the different references for those stats, just if you're interested in looking further into those. So if, say I spoke to my healthcare provider, and we made a decision that we're going to stop my sleeping pill, but then how do I go to sleep? What's going to happen? Am I going to sleep? Well, it's funny because when we talk, to patients who are taking sleeping pills, they often say, I'm not sleeping well, but they really need their sleeping pill. But your sleeping pill really is not doing a whole lot for you if you're still not sleeping well. So it's kind of like it's a funny train of thought because people are still not sleeping even though they're being prescribed a sleeping pill. So is that sleeping pill doing any benefit at all if you're still coming back because of your sleep issues? So it's really not the answer to your problem, right? So on our website, we do have a brochure. It's a big, thick brochure about how to get a good night's sleep without medication. And it goes through every single step that you need to do to kind of improve your sleep without relying on medication. And our intent for that is that you have a discussion with your healthcare provider. They can have access to the brochures because we do send them out to healthcare providers, or we would send them out to community groups as well. And so our intent is for that to kind of be a brochure that's used between both parties. So I'm going to go through it. The brochure is really thick and there's many, many steps. So I'm not going to hit everything, but I'm going to go through some of the discussion. So what do we suggest instead of sleeping pills? Well, there's something, it's called sleep therapy, but essentially it's known as cognitive behavioral therapy for insomnia, shortened as CBTI. And CBTI is composed of 5 different components, and all of these steps combined are what is coined sleep therapy. And it is the recommended first-line treatment for individuals who are having problems sleeping, which is known as insomnia. It's more effective than sleeping pills. It lasts longer, has long-lasting benefits, it's much safer, has no side effects, and it is less costly than taking sleeping pills for months or years. So there are 5 main components of cognitive behavioral therapy. One of them is sleep hygiene, which I'll speak to in a little bit. The second is relaxation therapy, sleep drive or sleep restriction, controlling stimulus, and the 5th is cognitive therapy for our thoughts and controlling those worries, thoughts that happen just when we're trying to go to bed or when we wake in the middle of the night. And it seems like our worries are a lot worse during the night. I know for me they are than they are during the day. So I'm going to go through some of this there now. So what does it mean about stimulus control? So we want to associate the bed with only sleep. So we really want to take control and develop good sleep habits. We only go to bed when we're sleepy. We only use the bed for sleep and intimacy. If you're awake for greater than 20 minutes, then you need to get up out of bed and then do something that would be consider relaxing, but not screen related. And then the 5th thing would be to go to bed the same time each night, but rise the same time every day. So it's like we talk about with babies. I got toddlers, so I guess it's it's not that long ago for me. But when we talk about infants, we talk about the importance of routine. Routine is really important for all of us. It's not just for infants in terms of our sleeping anyways. We all need to try to go to bed the same time each night, just try to be consistent and then rise the same time every day. So what is good sleep hygiene? So there's a number of things that is coined, what would be fall under this, what they say is good sleep hygiene. So one is caffeine, which is a stimulant and should be avoided at least 4 to 6 hours before bed. Believe it or not, nicotine is also a stimulant. Some people don't realize that, and smoking before bedtime or in the middle of the night can hinder your sleep. A light snack before bed may help you sleep, but eating too much will have a contrary effect and can cause things like heartburn. Alcohol is a depressant, so we would think that that would help us sleep. And while it may help you fall asleep quicker, you'll often wake up shortly after, so you get a really disrupted sleep. Exercise is certainly something that we would recommend, with consideration from your healthcare provider, and it will likely help you sleep. However, if it's too close when you go to bed, then you might get a lot of extra energy, and it has a stimulating effect. So you need to just ensure that you're familiar with how exercise affects you. Keep your bed uncluttered and clean, and your mattress and pillow comfortable. Keep your room at a comfortable temperature, and sleep in a dark and quiet room. So all of these things are things that you guys can reflect on and consider in your own individual circumstances, how it affects your sleep and does it affect your sleep. And I think if you're going to explore the cognitive behavioral therapy further with your healthcare provider, that I would recommend that you kind of think about these things and maybe jot down like a sleep diary about things that are interfering with your sleep, things that you're finding are helping with your sleep, changes that you made and whether or not they improved your sleep or they didn't make a difference at all. So having those things kind of listed down, maybe, write down when you normally go to bed, when you wake up, all those things would be helpful in having a conversation with your healthcare provider about the cognitive behavioral therapy. The other thing we need to do is dispel myths about sleeping. So not all of us need the same amount of sleep, and there is in fact not one such thing as an optimal amount of sleep. And what I mean by this is there's no certain number of hours that is an optimal number of hours. So our sleep patterns do change naturally as we age, and most older adults need about 5 to 7 hours per night. But I'm by no means saying that this is a set number of hours. What's really important is that you need to feel alert and well rested when you're awake. So that's what we're looking for when, we're trying to improve our sleep patterns and our sleeping, is that the end outcome will be that you feel alert and well rested when you wake. I'm not sure if any of you are familiar with sleeping pills or not, but I can almost guarantee that when you take a sleeping pill, it's likely, certainly when you begin to take it, you may feel groggy and, it's kind of like it's basically like a fog. Sometimes you wake up with a fog, especially if you haven't had enough hours from when you took the sleeping pill to when you woke in the following morning. So certainly something to be aware of as well, because this can impair your judgment and the driving the following morning. Excuse me. So basically, with all this said, what do we want you to do? So if you're taking a sleeping pill, if you know somebody who's taking a sleeping pill, if you're having issues with sleeping and you're considering a sleeping pill, let's speak with your pharmacist, doctor, or nurse practitioner. You can ask for support from your family or friends, then follow the plan that's going to be provided by your doctor, pharmacist, nurse practitioner, and then we can record how you feel. And based on that, we can make an assessment about the next steps and how we can work with you to improve your sleep without relying on sleeping pills. So next, I'm going to jump into reflux medications, which are referred to as proton pump inhibitors, or sometimes PPIs for short. So what is acid reflux? How do we manage it? So acid reflux, or heartburn, is when acid from the stomach flows back into the esophagus. And there are many ways to manage it, including lifestyle changes and medications. And as I said, one group of medications that we're focusing on is PPIs. So these here are the names of common PPIs, and it is likely that many of us have taken one of these in our past. So if you're probably familiar with some of those. So what are they? Like I said, they're medications used to treat heartburn, reflux, and stomach ulcers. They're really common medications because they work really, really well. They're usually well received. Like there's not a lot of side effects, long-term effects, and they work really, really well. People have heartburn, they take it, the heartburn goes away, they feel so much better. The key thing to remember is that there aren't many indications when we would need a reflux or heartburn medication for longer than 3 months. Now, this is not a blanket statement. I'm saying for most people, PPIs, when used for heartburn and reflux, are not needed for longer than 3 months. Now, that's not to say you might not have to go back on it. Something could change and you may need to get, your PPI again. But generally speaking, within 3 months, that's the length of therapy for a PPI for those conditions. So essentially why we're looking at PPIs is Newfoundland Labrador has a high use of those medications, but also because we tend to be on them for years and years and years, when only the majority of people are taking them for heartburn and reflux, and those people would only need them for 3 months. So basically, why are we continuing to take a medication that we no longer need? I can recall somebody who was prescribed a PPI for a cough that the physician or their primary healthcare provider thought was as a result of reflux. So they prescribed it. 12 years later, she was still taking that PPI for that purpose. So, and she actually became familiar with the work that Quality Care and Choosing Wisely Canada and Newfoundland Labrador is doing, as well as SaferMedsNL. And upon kind of learning this, she decided to approach her physician and have that conversation about the PPI, because she didn't want to take a medication that she didn't need. And that's basically what it comes down to. But that's an individual decision that has to be assessed and made for each person, because we really, really do need PPIs, but it's sometimes a small percentage of people need to continue taking PPIs long-term. So if you're taking a medication that irritates the stomach, you may be prescribed a PPI to accompany that medication to mitigate the side effect, and you may continue to take that long-term. If you've had a history of a major stomach bleed, if you had a Barrett's esophagus, severe esophagitis, and Zollinger-Ellison syndrome. These are the smaller percentage of people, but it's really, really, really important that these people continue to take their PPI chronic long-term. So, our campaign is really trying to distinguish that and make sure that that's clear, that people do need them, but not all of us need them for long-term. So can I stop taking my stomach medication? We know that depends on each individual decision, like I said, but ideally we want you to talk to your pharmacist, doctor, or nurse practitioner to see if you're able to stop your medication. And if so, how are we going to do that? So if you're taking a PPI for acid reflux, then you really need to consider lifestyle changes, because it's likely that there's some kind of a lifestyle factor that's influencing the reflux or the heartburn. So here are some things to consider, that even if you are taking a PPI, you should, consider these factors alongside they complement taking a PPI as well, because we need to assess whether or not a lifestyle factor is causing the reflux, and if so, how can we change the problem? So the following foods can trigger heartburn and reflux: so fried, fatty, or junk food, citrus foods, foods with a lot of tomatoes, onions, and garlic, spicy food, and alcohol. That's just those are the more popular, I guess, foods that cause, but you might have something that triggers heartburn that's not on this list. They also recommend eating smaller meals. If you're finding that a large meal causes a lot of gas and reflux and you feel bloated, well, let's try some smaller meals. Smoking tends to cause reflux. Maintain a healthy weight. Avoid eating just before bed or lying down, and avoid tight-fitting clothes like a belt or tight, stuff around your stomach can also cause issues. So consider all of these things. And again, it kind of comes back to the sleeping pills. Think about a diary. You know what I mean? Let's start keeping track of stuff that, when do I have reflux? Is it because I'm having a glass of wine with supper or beer or whatever it might be? Is that when I'm having it? Or is it, something completely unrelated? So let's try to keep track of the reasons, and then we can kind of fix the cause. So I spoke a lot, I guess, to the work that SaferMedsNL is doing. So I'm just going to speak to who we are now. And essentially, we are a group of healthcare providers and leaders, clinicians, decision makers, patient advocates, and academic researchers who have all come together in Newfoundland and Labrador to try to create change and promote positive change in how Newfoundland and Labradorians use their medications. And really, it's all about just creating awareness and informing people and inspiring people to ask questions about their medications, because just because something was prescribed for a condition last month, 3 months ago, 2 years ago, 10 years ago, doesn't mean it's necessarily needed. So all of these different groups and many, many more have, are part of our steering committee. And if they're not part of our steering committee, then we work really, really close with these individuals to promote the appropriate use of medications. We focus on two particular, which I said was sleeping pills and PPIs, because we needed to start somewhere. But our messaging also goes beyond that, in that we want to create change and facilitate conversations between patients and their healthcare provider. So our SaferMedsNL really is a public awareness campaign. So that's the guts of what we do. We do a lot of healthcare provider education. We work with government. We've worked with pharmacists, nurse practitioners, physicians, and we've created material for those individuals, and we've created material for the public. But the guts of our campaign is, we're leaning on a lot of our partners to kind of do some of the work with their healthcare providers, and we certainly lean on all of our community organizations to help us get our message out. They've been critical in achieving our goal. But what we do is a public awareness campaign. So hopefully some of you have seen some of these campaigns. In the first year, we focused on PPIs, and our campaign was some things just aren't meant to be long-term, which looked at heartburn medication. A lot of that, I was in pre-COVID times, I was able to go across the island. We did mall campaigns, and we had a lot of posters, and we kind of did the more traditional campaign as well as TV, and we did it across the media as well, and radio. Then COVID happened, and we had to shift gears, and we went, more digital, which unfortunately doesn't reach the entire population. We're quite aware of that, but I guess it's the next best thing when you can't do in-person events and you can't hand out physical information. Then you need to rely on the digital environment as much as we can. So we shifted our gear to a more digital campaign. So just going to play this if I can. If it doesn't work, no big deal. You'll hopefully see it. I can share it in a link later. But this is one of our campaigns for this current sleeping pill campaign that we're doing the spring 2021.
Sleeping pills make you 5 times more likely to have memory problems. Sleeping pills make you 4 times more likely to feel very tired during the day. Get educated about your sleeping pills at SaferMedsNL.ca.
So we work with we work with an advertising company to help us develop this, because while we might have the information, we certainly don't have the creativeness that's needed to develop, or I shouldn't speak for everybody. I don't have the creativeness that's needed to develop something that's catchy, speaks to the public, and whatnot. But they've worked with us to develop 3 different campaigns like this. So these will be on NTV, CBC over the next 6 or 8 weeks. We'll also have them on Facebook, radio, and online, NTV, as well as cbc.ca. So over the course of the last couple of years, we've been able to look at what's worked best and what seems to reach the majority of people, and it seems like we get the most traction from those avenues. So we decided to focus put our focus into those areas. And of course, we recognize in CBC reach Labrador. That was something we really felt was important, because it's so difficult. I've certainly learned over the course of this campaign that it's really difficult to reach everybody across the island. So we've tried to be very cognizant of that. And I want to thank, because I know I recognize a couple of names that were here this morning on the call. I want to thank anybody that's helped us work through that over the last couple of years. So I hope you found the presentation to be somewhat informative, and if you leave here today with anything, I hope this is the takeaway message that you leave with today. So what can you do? I hope you can make a special appointment with your doctor, pharmacist, or nurse practitioner, and ask if you can reduce your medications. So of course, as I've said throughout, never stop a medication without first speaking to a healthcare provider, but let's start the conversation. Oftentimes we're so busy, we go in for something acute or urgent at our doctor's appointments, or when we go in to see the pharmacist, we're running in, grabbing our refill and leaving again. But, maybe set aside a time that's convenient to book an appointment instead of just, jumping in and having to leave again and never getting a time to reassess your medications. So here are 5 questions you can ask. So first and foremost, why am I taking this medication? What are the potential harms and benefits of these medications? Can it cause harm if I'm taking it for longer than needed? Is it possible to stop or reduce the dose? And who do I follow up with and what and when? And I think if a new medication is started, that's a really important question to ask, is who am I following up with and how long am I going to be on this medication for? I got 2 more slides. So other than that, what else can you do? Well, inform yourself about your medications and why you're taking them. Engage in discussion with your doctor, pharmacist, or nurse practitioner about deprescribing and if there's alternate therapies. Spread the word about deprescribing to friends and family groups and policymakers if you're involved in those circles. And then visit SaferMedsNL if you want more information, and follow us on Twitter and Facebook, and share our post so we can spread this message as far and wide across Newfoundland and Labrador as we can. So that's it. These are a couple of websites. MySleepWell.ca is a fabulous website if you're able to log into that and learn more about cognitive behavioral therapy. They break that down perfectly. And then the Canadian Deprescribing Network, SaferMedsNL, and deprescribing.org also have a lot of information about sleeping pills and proton pump inhibitors. Here's my contact information, and that's it. Thank you very, very much. I'm going to stop sharing now.
Thank you, Kelda. That was a wealth of information. I was thinking actually, while you were speaking about sleeping pills and everything, gosh, I'd almost like to have someone on to talk about other kinds of medications, like something I'll have to explore.
Yeah,
anyway,
sure. I could have had a presentation on each of those between sleeping pills and PPIs and cognitive behavioral therapy. I could have had a separate presentation for all of those.
Just a quick story. My mom passed away from cancer now I'm going back to 1989 here, which isn't that long ago for some of us. But anyway, towards the end, she was very ill and she wanted to die at home. So we kept her home. And anyway, she was taking all these medications. It was just getting so overwhelming. So I phoned her doctor and persuaded him to come make a house call. And he did. And so I had all Mom's, my dad and I were there. Dad had a big bowl in his lap. And I had all Mom's meds on a table next to the bed. And I'd pick one up. Okay, what good is this right now? And anyway, we ended up with 2 bottles left. I would pass the pills to Dad, and he'd take the cover off and dump them in the bowl. That whole bowl of pills that were useless to her, and it's just, and I mean, she did have cancer, and I know that's what she died of, but you have to wonder what effect all that stuff was having on her. Anyway, yeah. We do have a few questions. I'm sorry, Kelda, you were going to say something.
I was just going to say, oftentimes medications are kept added on, but we never think about whether or not some of the ones that we are on are still needed. So that's kind of a shifting thought that we need to do, right? Instead of just keep adding. Yeah. Sometimes we aren't, it is needed, we do need to add, but is there an opportunity to remove as well? Yeah.
Oh, absolutely. Okay, some of the questions that came up. Well, one thing, Noreen and I actually were both wondering the same thing. What age does SaferMedsNL regard as a senior? Are you doing 65 up or?
So our campaign is actually aimed at 18 years and older. So we're doing all adults. However, we do focus on older adults, which we coin 65 and older, but I don't know necessarily if it's the number that we're looking at. But the reason why we're focusing on older adults is because the harms, tend to be greater there, and they're more susceptible to those harms. So especially for sleeping pills. So that's why we're targeting, I guess, older adults from that perspective. Yeah. Okay,
that's good. And another question was, I think it was Tabitha, would melatonin have the same effects as prescribed sleeping aids?
Right. So melatonin is different than sleeping pill. It is natural. So it's a hormone that our body makes to help us sleep. And it might help with like shift workers or people who might have jet lag to kind of adjust to a new sleeping schedule. However, it and it's usually well tolerated, but it does have some side effects like everything. So fatigue, headaches, dizziness, or irritability, those are some side effects. But with that said, it's not one of the medications we're targeting. It is not what we would call a benzodiazepine or sedative hypnotic. Doesn't have the same, the same side effects as those medications. And it may help shorten the amount of time it takes to sleep, but not by very long. So about only 7 to 12 minutes, I think, is what they say. So I don't know how much benefit there is there, just to help, except for to help people kind of regulate their sleep schedule. That seems to be where the evidence is for melatonin, but it's not one of the medications we are targeting, and that we coin in that group of sedative hypnotics.
Yeah. Tabitha, do you have anything else on that? You're okay.
Okay, I finally got it. No, I was just I was very curious around that. I do hear a lot of people using that. I've never used it myself personally, but I am aware of a significant amount of people using melatonin at night.
Yeah.
So I wasn't sure if it would have the same side effects as the prescribed sleeping aids.
Right, definitely not. It doesn't have the same association with like the risks, the fractures, that type of the falls. Sorry, not the risks, the falls, the fractures, those types of things. It's not coined in those those medications.
Okay, thank you.
Kelda, are you going to be able to share your slides with everyone? Like, can you send me a copy and I'll send it out with the link to the recording?
Yeah, I can do that after we stop this morning.
Perfect.
My
That
pleasure.
is great. Okay, Lori. Lori had a question here. Lori, do you want to ask your question yourself, or you want me to ask it?
Oh, you're doing a good job.
What has the buy-in been from physicians, NPs, whatever that is,
Nurse
across the province? Sorry?
Nurse practitioners.
Oh,
So
okay. What has the buy-in been from physicians and nurse practitioners across the province when discussing the ideas of reducing medication?
yeah, that's a great question. And that's a really great question, and one we get all the time, and really important. So generally speaking, we've had great buy-in from, and I'll kind of speak to this from two perspectives. So from SaferMedsNL, in terms of our program and our initiative, we've had excellent partnerships with our nursing, the College of Nursing and the NLMA and Pharmacist Association and the boards and whatnot. So been absolutely fabulous. They've been instrumental in getting our messages across, out to prescribers. And as well, we have individual pharmacists, doctors, and nurse practitioners, who sit on our committee to help inform us from that perspective, from that healthcare provider perspective. So we have absolutely wonderful buy-in. And from I think generally speaking, it's fair to say that everybody buys into deprescribing. Like, everybody understands that if the need to reassess medications, the need to the need to not continue something that's causing more harm than good, to have that decision and that assessment done. I think that's fair to say. I think the issue likely is what's a priority for that particular healthcare provider, what's a priority for the patient, and what the time that's available. There's so many reasons why a patient might be visiting their healthcare provider, and it seems we hear that time is one of the biggest issues that that people just don't have the time to have this conversation, because there's so many other things that are acute and need to be dealt with at that particular time. And so that's one of the reasons why I mentioned having the conversation, making an appointment, with your healthcare provider, specifically for that reason. So the person knows you're coming in to have your medications assessed. They can set aside longer than the typical, I'm not sure, I think, it's different, but 5, 10, or 15 minutes, however they normally set aside per patient. They can set aside a larger chunk of time, and they know what you're coming to do. And, I think just as another tidbit before I jump along, if you are going to do that, make sure you include not just your prescription medications, but include the herbals, the vitamins, the over-the-counter medications that you take. Bring everything along. They sometimes call it like a brown bag. Put everything in a bag and just bring it along to whoever you're seeing, whether it's your pharmacist or your doctor or whoever. So, buy-in's been good. I think people want to do it. They understand the importance of it, but finding the time to do it has been a challenge, I think.
That moves quite nicely actually into a question Joan asked. And Joan said, I love the idea of losing the unnecessary meds. However, when your medical practitioner feels he knows better than you about meds and tells you to get used to it, what do you do?
Yeah, that's a great
I
question.
look for a new physician. Terrible.
It's a great question. And, you know, I think multiple factors play into that because they had the medication background. So they're looking at it from that perspective, I guess. But then you know how you're feeling, you know, your personal health and whether or not you're feeling good, you know, when you take a medication or, you know, whether it seems like it's causing side effects, that type of thing. My suggestion to you would be to maybe make a relationship or connection with another healthcare provider. And this is not to pin one person against the other at all, but maybe connect with your pharmacist in your community, the pharmacist you see, ask them opinion, and perhaps they can, you know, provide further information. They might be able to inform from a different perspective. They might be able to connect with the doctor and have a discussion and be clear up if there's any miscommunication or misunderstanding of information, because it's really like, you know, why do you feel one way and then your doctor feels another way? Like, you know what I mean? So I guess I would suggest perhaps speaking to another healthcare provider and having that conversation, because we really want this to be a mutual decision that both parties are you know, on the same page and are trying to improve outcomes.
Yeah. Actually, someone, I think it was Joan that suggested that too. A presentation on blood pressure pills and cholesterol pills would be awesome. Do you do those, Kelda?
So there's not a focus of SaferMedsNL, but of course I'm a pharmacist, so I could prepare something, or I might be able to put you in line with somebody who would be, you know, working with those meds on a regular basis. I could do that too.
Let's talk about that afterwards.
On the theme of let's talk more
Don't
about
your wish may come true.
Yeah.
I don't know. Does anybody have anything else? Anybody have any? Oh, and here we have seniors in medical cannabis too. And that's a good point.
Yeah, that's a fabulous point.
Yeah. Okay.
I think every time I speak to a group, I get a suggestion about cannabis for seniors. Yep. I'm not surprised to see it pop up as a potential topic.
Well, we shall try to make these happen. We aim to please if we can. Any more questions? Does anybody else have any questions or comments you would like to share?
I thought that was a great presentation. Thank you very much, Kelda.
Thank you very much.
Noreen here. I'm just going to say I put your piece in about the discussion on medical cannabis because doctors, some of the newer doctors and some of the longer term doctors are getting more open-minded for medical cannabis around chronic pain or whatever. So I think it's a great discussion. Warrants great discussion.
Yeah. Anyone else? Kelda, thank you so much for taking the time to come here and do this for us. And I'll certainly be talking to you about the other topics that came up here this morning.
Wonderful. Thanks, everybody, so much.
I just want to show my slides again, just to see if there's anything I'm leaving out here. Oh yes, if anyone needs a certificate for, part of job-related professional development or university education, just let me know and we'll whip one off to you. I had forgotten about that. And also coming up next on Let's Talk About next Tuesday. And we did this, Kelly Heiss, the Executive Director of SaferMedsNL, and I did this session a month ago, and we're going to do it again. the what, why, who, when, and how of advanced care planning. All right, we're going to do that again next Tuesday from 9:30 to 11. I will be sending out invitations to everybody. And a few weeks after that, I haven't pinned down the date yet, we're going to invite the people who attend next week's and the ones who attended the advanced care planning a few weeks ago. We're going to invite those two groups to come and do a special session on actually making an advanced healthcare directive. So you can you have that to look forward to, and we sure hope that we'll see some of you there. And again, everyone, thank you so much for joining us. And again, we thank United Way for sponsoring us. And thank you, Kelda, very, very much. Bye, everybody. We'll see you again soon, I hope.